my name is Chelsea Maybibal from BSN 1A. So in this video, I will be demonstrating the mouth and the Oropharynx assessment. So this exam is important because through this, we are able to identify the mouth problems or abnormalities. It is very important for us to have or take this assessment in order for us to know more about what the problem is and how to resolve it. So in this exam, I will be using the gloves, the tongue depressor, the pen light, and the ghost pad. So good afternoon, ma'am. My name is Chelsea Medibal, your nurse for today. So I will be performing a mouth and oropharynx assessment. Would that be okay with you?
Yes.
Okay, so this exam includes evaluating your risk of developing other oral problems. So this will also include checking your face, neck, and your mouth for abnormalities. So in this assessment, I just need you to relax. This will include you opening your mouth wide. So let me check and assess for it. So would that be okay with you?
Yes.
Do you feel any kind of pain right now?
No.
Okay, so let's start. So let me ask you first several questions. So when was your last visit to your dentist?
About 4 months.
Okay, so do you have any partial dentures?
No.
Okay, so do you have any medications from your dentist?
No.
Okay, thank you. So now if you could just sit comfortably for me.
Okay, so now.
Okay, ma'am. So now I'm going to inspect for your lips and your buccal mucosa. Okay, lips. So can you please open your mouth for me? Okay, thank you. So based from what I have observed, your lips are pink. It has no masses. It is symmetrical and also no ulceration. So can you purse your lips po as if you're going to whistle? Okay, thank you. So now I'm going to inspect and palpate the inner lips and the buccal mucosa. Open your mouth wide po. Okay, thank you. So for the teeth and gums, okay, thank you. So I've asked you earlier if you have partial dentures and you said you haven't. So now I'll go to inspecting your tongue and the floor of the mouth po. So can you protrude your tongue po? Okay, thank you. So can you please roll your tongue upward? Okay, so now move it from side to side. Okay, so no unnecessary movements of the tongue. Okay, ma'am. Next will be the inspection of the base of the tongue, the mouth floor, and the frenulum. So can you please place the tip of your tongue at the roof of your mouth? Okay, thank you. So now I'm going to slowly palpate your tongue and mouth floor for any lumps or any nodules. So I have here a ghost pad. So I will use this to grasp the tip of your tongue, and then I will slowly palpate its borders po. Okay, so can you please put out your tongue po? I'm going to put this at the tip. Ilabas mo po ang dila. Okay. I'm going to slowly palpate. Open wide. Okay, I'm going to slowly palpate the borders of the tongue. Okay po, now for the base. Okay. So now I'm going to inspect the mouth floor to prevent my client to possibly bite me. I'm going to um, I'm going to place my finger under her jaw and then push in her cheeks. Then palpate the. I'm going to insert my finger po to inspect for your for the mouth floor. Okay. Okay po. Thank you so much. Okay, ma'am, for the palates and the uvula po. So I have here po a tongue depressor and a pen light. So I'm going to use this po to depress your tongue and check for the uvula, the position of it, the hard and the soft palate also. Okay, so can you please open your mouth widely po, tilt your head, then I'm going to insert this po. Okay, so for the hard palate, for the soft palate, and the uvula. Okay, thank you so much. Now po, for the position of the uvula, can you please say relax your tongue lang po for me to be able to see the uvula po. Okay, thank you. Okay, ma'am. So now for the oropharynx and the tonsils. So for the color po and texture of the tonsil, I'm going to use again the tongue depressor one at a time to avoid eliciting the gag reflex. Okay po, so tilt your head backward po, then open wide po. Okay, so now I'm going to elicit your gag reflex by pressing the posterior tongue with the tongue depressor po. Okay, open wide po, left. Okay po, thank you so much. Okay, ma'am, now po, I'm going to document my findings po. So, your findings po, based on my inspection, the lips are pink, no masses or ulcerations and fissures. So, the gums are pink, smooth, no swelling, also no bleeding, and no signs of any discharge. So, the tongue is normally midline and covered with papillae. Salivary gland shows no tenderness, no foul odor of breath, no hoarseness of voice. The uvula is completely symmetrical. The entire oral cavity is pink without any ulcerations, palpable masses, or lesions, or any swelling, and no suspicion of malignancy. So that ends our examination. Thank you so much.